Next plenary session starts now. This is going to be anchored again by very two eminent persons. And we're talking about demographic dividend. If you remember yesterday, the senior executive course 42 from the National Institute of Policy and Strategic Studies actually gave us a presentation of their research on population growth and human capital development, the challenges and opportunities. So this plenary session is going to look at it from different angles. How do we realize the demographic dividend to accelerate economic growth in Nigeria? And there will be two parts to it, but I'll call on the first two moderators quickly so that they can come and anchor this. It gives me pleasure to welcome to the high table Dr. Olumide Okunla, who works with the World Bank, even though there's one other name, the IF, you know, whatever name it is, but he's the World Bank, the bank of the whole world. Please, let's give him a round of applause. He holds the money of the whole world in his hands. Let's take it first before you know. And then our chairman of AAFP, chairman of the local organizing community, Dr. Ejike Oji. Please welcome into the high table. And they will moderate this session and call on the speakers that are available. I believe most of them are online. So Dr. Ejike, Dr. Okunla, the floor is yours.
Hello. Hello? Okay. Good morning, everyone. So you're welcome to the 21st National Family Planning Conference, 6th December 2050. You're welcome to the 20th National Family Planning Conference, today, 6th December 2050. Anybody has a problem with that? Very good. Very good. Now I truly have your attention because sometimes when you say 2050, people think 30 years is like light years away. So let's all transport ourselves to the year 2050. I'm just going to, whilst welcoming you to this plenary session, we have a couple of distinguished guests who will provide insights on this topic after I have provided the context. And we're very glad to have them on this session. Most particularly, the fact that we have two ministers who are registered to be here. So let's show what 2050 is like. Today, 10th December 2050. We have become the third largest country in terms of population. We are 435 million people. So rather than seeing gay, happy people here today, we're seeing people in despair and hopelessness. That's the situation of 2050. That's a kind of urgency we are dealing with. If you look out there, today, 10 December 2050, you have our youths roaming the streets without jobs. That's a reality facing us today, 10th December 2050. But why won't it be so? Nigeria is described as a large country, but with 435 people, we're only a small 435 million people. If you superimpose Nigeria meter for meter into the United States, we're not even as large as the state of California. Yet, we have more population than the entire United States. So, we are reading the news this morning, you have headers clash, people fighting over land. We have the complications of climate change. That's what's in the newspaper today, 10 December 2050. I need not talk about the size of the adolescent population that has risen so rapidly. When you have this kind of number that I'm showing on the screen, it means then you are mandated to provide jobs for them. So the Minister of Finance at the time, in 2050, needs to find how to create 100 million jobs. So, however, there's also a flip side to this. There's a flip side to this. So this yes could be 10 December 2050, but one in which there is lower people in poverty, which means that in fact we are a very rich country. That's the other side of 2050. And that actually can be achieved if we're able to speed up our fertility decline. So, and several countries have done so. Bangladesh, Malaysia, Indonesia, countries with similar sociocultural attitudes with us. So just to describe how we can achieve this, so that the earlier part of my presentation, which simply describes a state of demographic disaster, doesn't happen, rather one that we will yield a dividend, we have a couple of panelists who will give us an insight into how we can achieve this. And it's my pleasure and honor to invite the Honorable Minister of State of Health, distinguished Senator Dr. Olorunimbe Mamora. I don't know if the back end could confirm whether the Honorable Minister of State has logged on. He had logged on earlier. All right, sir. The Honorable Minister, sir, we yield the floor to you to kindly give us your opening remarks. Thank you, sir.
Right. Thank you very much. Distinguished panelists and participants on this platform. Distinguished ladies and gentlemen, I am delighted to be here for this 6th edition of the biennial Nigeria Family Planning Conference. And I must say that I feel deeply honored to speak at this very important event. The focus of this plenary session on accelerating economic growth in Nigeria is timely and apt, considering the economic growth in Nigeria. And of course, the contemporary economic challenges which our country is presently facing, obviously arising from so many factors, particularly the COVID-19 pandemic, as well as the aftermath of the NSAS protest. While all stakeholders work assiduously to see that Nigeria exits the current economic recession and remain on track for steady economic growth, event like this is highly recommended as it provides platform for all relevant stakeholders and partners to engage and have robust discussion on how to accelerate economic growth in Nigeria. It is an established fact that there is a strong positive correlation between health and economic growth. Hence the saying, a healthy nation is a wealthy nation. Nigeria is currently ranked the 7th most populous country in the world, with an estimated population of about 200 million, of which a very significant proportion are youth. While the large youth population in Nigeria can be leveraged for economic prosperity, the same population has the potential to become an economic time bomb if its growth is not slowly paced. Population models have estimated that based on the current population growth rate, which is over 3%, Nigeria is on track to become the 3rd most populous country in the world by the year 2050, with an estimated population of about 400 million. This rapid population growth, if not accompanied by commensurate economic growth and development, may likely lead to increased poverty and pressure on the existing infrastructure. Will Nigeria allow its population to rise unchecked and face the impending economic woes that may follow? Or will we do the needful to slow down our population growth rate and leverage demographic dividends to accelerate economic growth and prosperity? These questions are pertinent and key to the economic trajectory of our country over the next few decades. Hence, the need for all of us to ponder on these issues. With our pyramidal population age structure, comprising largely of children and youth who are within their reproductive age, family planning and population education are key to the realization of demographic dividends. As Nigeria continues to strive to reduce the level of poverty in the country, a rapidly growing population is not desirable, as it will reduce the likelihood of children having access to the basic health and education, reducing Nigeria's potential for economic growth. The government of Nigeria has remained committed to an expansion of coverage for family planning for the populace and continues to implement innovative programs that increase the uptake of family planning by all population groups. The government made commitments at the London Summit of Family Planning in 2012 and has since then provided an enabling policy environment and resources to meet the family planning goals of the health system. Several socio-cultural norms, such as religious beliefs, limited decision-making power of women, low levels of female education, and the preference for large families, as well as different myths and misconceptions about family planning and child spacing, have slowed down progress towards increasing the uptake of family planning in Nigeria. Significant progress has been made despite these challenges, and the government will ensure that the current momentum is increased to lead to a rapid decline in fertility rates. With a present report indicating that there are unmet needs for family planning in Nigeria, there is a need for increased investment in family planning to complement the efforts of the government and other stakeholders in providing affordable family planning options for the populace. This increased investment in family planning and health education will lead to a deceleration in our fertility rate and will increase our prospects for demographic dividends. As Nigeria intensifies efforts to reduce maternal and child mortality rates and increase the uptake of family planning, will significantly contribute to reduce maternal and child mortality, as increased family planning uptake have been associated with low maternal and child mortality rates. The Federal Ministry of Health, in keeping with strategic objectives of the National Strategic Development Plan 2, has continued to provide access to family planning commodities in a bid to substantially increase the contraceptive prevalence rate in Nigeria. This had been done through the procurement and distribution of family planning commodities, improvement in the supply chain management system for family planning commodities, training of healthcare providers on family planning techniques, and the promotion of demand creation for family planning services. Distinguished ladies and gentlemen, you will agree with me that there are considerable social and economic gains from demographic dividends in Nigeria. Hence, it is imperative that all stakeholders continue to sustain their efforts at increasing the availability and utilization of family planning services. I thank all our partners, non-governmental organizations, civil society organizations, and healthcare providers that have ensured that the provision of family planning services in Nigeria continues uninterrupted. The administration of President Muhammadu Buhari remains steadfast to actualizing the visions on the health sector next level agenda and commits itself to increasing financing for the health system to ensure that Nigeria remains on track to gaining demographic dividends. I implore all stakeholders and partners to ensure that they continue with all programs and interventions that will complement government efforts to increase family planning uptake and reduce fertility rates. I thank you very much for your audience and wish you fruitful deliberations that will foster economic development and prosperity in Nigeria through demographic dividends. Long live the Federal Republic of Nigeria. Thank you very much.
Thank you very much, Honorable Minister. We're very grateful for your time. Please, the Honorable Minister of State deserves another round of applause. Thank you very much. We're going to move extremely fast at a neck-breaking speed now. And may I call on Ms. Yosola Kimbi, who is the SSA to the President and the coordinator of the Human Capital Development Working Group in the Office of the President, and also a member of the National Economic Council Secretariat. Why is she talking to us? Nigeria used to be 34 number 34 on the Human Capital Index, 5 from the bottom. The latest index, we moved 2 points to 36. This is being addressed directly by the Office of the President. Ms. Akimbi, what is the government of Nigeria doing on improving Nigeria human capital indices? Over to you, ma'am. 3 minutes.
Thank you. Thank you very much, Dr. Olumide. I'm going to try very hard to actually do this in 3 minutes. Just like you said, it's to set the context, human capital development. The Nigerian government is not living in denial at all in terms of where we are regarding human capital development. And of course, this is a recognition of the fact that we know that human capital development plays a critical role in accelerating development, boosting productivity, and of course also reducing poverty. And to this extent, the National Economic Council, which is that council of 36 governors of Nigeria, set up a committee, a core working group, which I coordinate. And the core working group consists of different partners and different agencies of government. We have the Federal Ministry of Health, of Education, Labor Force, because those are the 3 critical thematic areas that we think is really important for this accelerating human capital development. We also have different development partners, including the World Bank, DFID, now FCDO, we have Aliko Foundation, we have Bill and Melinda Gates, all members of this core working group. And together, we're working towards accelerating human capital development. We have set this up in 2 phases. The phase 1 essentially is to actually have a vision, the strategy that is driving this, which we have done. And the second phase is working with all the statistics, making sure that we're all working together, but we are taking the lead to take them towards that process that we have actually agreed will help us in accelerating human capital development in Nigeria. And the vision we have for ourselves is to have healthy, productive, and to ensure that we have educated Nigerians by the year 2030. On purpose, we have said 2030. I had Dr. Olumide talk about 2050. Perhaps 2030 is ambitious, no problem about that, but we just need to be able to really, really see how we can move with space to move ourselves forward. And it's important for us to know that to have this transformation in our human capital development, we need to work together with the states. We know that the states are not in the same way. I mean, they are all having different development issues, but we know that because we have set that target to ourselves, target for Nigeria, we all need to know as a state, bring them on board to know what they can contribute towards moving forward and making sure Nigeria improves and move forward. And I must also relate this because the health component is really so critical. And we know that investing in universal health coverage is critical so that every person has access to quality and affordable health. And of course, that's the critical step to building a country's human capital. And as part of this, we know that every woman and child should have access anytime. Let me talk about the maternal, the reproductive, and the family planning. But essentially
one question for you before you go. I've been asked by the organizers that at the next National Economic Council meeting, can the report of this conference be presented to NEC? NEC is made up of all the state governors in Nigeria, chaired by the Vice President. And that's why so do we have your assurances that the communique through you and the organizing team will be presented to the Vice President in January?
Yes, we will present that report. Like I said, we've spoken to all the states. We have focal persons from the states, and we have deputy governors chairing the councils from the 36 states. So we have met with them. The challenge is enormous, but we know that once we make a presentation to council and the governors are present, what needs to be done will be fast-tracked. So in January, by the grace of God, we will make that presentation to council so that council can help us to fast-track what all the states, focal persons, and the chairmen of councils need to do to make sure that we're all on the same page in terms of activating human capital development in Nigeria.
Thank you very much. Please, a round of applause for Mr. Kimbi. So, Dr. Oji, I think you should meet with Mr. Kimbi so that the recommendations from this conference goes to NEC. NEC is actually very powerful and it's a policy tool we should use. Now, let's go to the field. Dr. Lawan, Honorable Commissioner, Yobe State. Yobe is a very critical state if we're to speed up our fertility declines. Dr. Lawan, I don't want to put you on the spot, but what is Yobe State doing to improve your numbers? Over to you, Dr. Lawan. 3 minutes.
Thank you very much, and thank you for having me. Yeah, just as a quick background, we know that Yobe State, or the northeastern part of the country, has been ravaged by insurgency for the past 10 to 11 years, and that has actually resulted in further weakening of the health systems, and then of course that has also resulted in increasing unemployment and other things. The second characteristics of the area is the high poverty rate as well as the low education. But then as rightly said, the numbers are actually not too encouraging. But then you'll also agree with me that several strides have been made in terms of improving child health outcomes, especially when you look at the immunization indices, LLI uptake, and other indices, which the state, despite the challenges, has made significant progress. Coining down to the family planning indices, what we are doing currently as a state basically is to look at the entire system, the health system in general, and then see how we'll be able to address the root causes of our weaknesses. Vis-a-vis what we have been able to do, or what we are currently doing, basically one is to strengthen our health institutions, improve the standards and then the quality of care. The other thing is that we're also working on increasing and improving our human resource for health capacity, and then build training of our health workforce, and then of course work on the attitudes, and then of course make our health workers more professional in their dealings with their clients. The third thing is that we also are working very hard to address our logistics and supply chain challenges. The state has, in the past 1 year, despite the COVID-19 pandemic, launched or floated the Yobe State Drug and Medical Consumables Management Agency. And we have actually also renovated and improved on our storage capacity. And then, of course, the other aspects that have to do with the supply chain. As it is, of course, the revolving fund schemes in the state are actually working. Have started. We've started seeing improvements in that. The state also, to look at the purchasing power of the people, removing financial risk, also established the health insurance agency. And then, of course, the state also, knowing the challenges and taking healthcare services down to the grassroots, is establishing primary healthcare systems in each of the wards of the state. This is deliberately done in order to improve access to the healthcare services. The state has 178 wards. As we are speaking now, over about more than 70 wards have these standard primary, which have been upgraded to establish this one functional primary healthcare centers per ward. This is deliberately done.
Thank you, Dr. Lawan. One thing is clear. If Yobe, Jigawa, Kebbi makes progress, Nigeria will make progress. And it's so impressive to hear several of the things that you are leading on in Yobe. Just as I close with you, how much have you budgeted for primary healthcare services in 2021 appropriation? And do you have the support of the governor to do that?
Yes, we do. The attention of the governor, the health sector is actually a priority of His Excellency. Amongst, he has 4 cardinal priorities. One, education. He has even declared a state of emergency in that respect. The second is around empowerment, especially youth empowerment. The third is in the area of agriculture. And then fourthly, the healthcare systems across the state. And amongst the healthcare, as I've mentioned, establishing healthcare systems
will certainly drive human capital development in Yobe. Please, a round of applause for Commissioner Yobe State. So maybe Nigeria is an outlier. Perhaps it is. We may argue over it. But if you consider the fact that in terms of neonatal deaths, we're number one. In terms of very early childbearing, we're number two. And I'm talking globally. In terms of absolute number of under 5 mortality, we're number one. There's a problem, ladies and gentlemen. But let's see what's happening in other parts of sub-Saharan Africa. Dr. Demola Lajide, UNFPA country representative, Kenya. Dr. Lajide? Yes, he has 3 minutes. He knows. He will do justice to it. Thank you.
All right, thank you very much, Dr. Okunla, and thank you, Honorable Minister, Honorable Commissioner, participants. I think essentially what a lot of the other countries have been able to do for those who have been able to make progress are simply a few things. Number one that we have to do differently is that the strategy has to be holistic and appropriately driven within that agency of government that is responsible for coordination of economic development. We heard the colleague from the presidency talk about human capital development. That will not be driven by the Ministry of Health. And so if we're looking at demographic dividend, looking at real transition in terms of the demography, it has to be holistic, and there has to be convergence of the national and state governments in terms of that agenda. They cannot be disparate strategies. The point Olumide was talking about in terms of population growth and the quality and the well-being of the population, again, is a question we have to interrogate. Will the population be better off when the growth rate reduces, or the growth rate will reduce when the people are better off? We do know that some countries have shown that when the economic circumstances of people increases or improves, they have less children. So it's important for us to understand that. Then the strategies on the soft issues have to be on point. Family planning cannot be donor-driven. Once it continues to be donor-driven, we do not have a handle on the agenda itself. That's very critical. Secondly, we must look at girl-child education, because we do know that when girls are properly educated, they start the onset of childbearing a lot later. And that also helps us deal with our population momentum. If we do not have life skills in school, some countries have eventually already have it well integrated within the school systems. We will continue to deal with issues of teenage pregnancy and adolescent SRHR challenges, which will give us a momentum that we cannot control. We have to begin to look at a comprehensive program on aging and older persons, not from the point of vulnerability or social support, but from the point of being able to support them to optimally contribute to national development. I always say one thing: if you are alive today, you have only 2 options. It's either you choose to die or you grow old. That process is going to happen. And the multisectoral intersection cannot be ignored. That's what you've heard from the Commissioner for Yobe because of the issues that we've seen in the Northeast. So issues of climate change, we've seen that in some countries immediately lead to child marriage, lead to teenage pregnancy, lead to population momentum. The final point I want to make is that addressing fertility transition or the demographic transition, addressing the population momentum, addressing the harnessing of demographic dividend cannot and must not be left to the health sector to drive. The health sector is equipped only to provide the service delivery for family planning. The other components of it lie squarely outside of them. So that's what a range of countries has been doing, and that's where we've been able to harness the demographic dividend and address these issues in those countries. Thank you.
Thank you very much, Dr. Lajide. Round of applause for Dr. Lajide. Thank you. Dr. Ejike Oji, we've heard from everyone. What are your key takeaways from this plenary session?
Thank you very much. For me, the key takeaway is that there are policies programs all over the country going on, and then the support from the international community. And I also have heard that most of these programs, they feel there should be some level of collaboration, some level of central planning, which will be inclusive, making sure that the federal government is in tandem with the subnationals. What we have seen in Nigeria is a lot of good things in a way happening at the federal level, but at the subnational level, it seems that we are in is a tale of two cities. So the federal is there and the subnationals are there. But in my own summary of everything, it's obvious that demographic crisis through transition through to dividend or prosperity is a deliberate thing. It's not a knee-jerk approach. What this means, we need to do 5 key things. Number 1 is what we are all preaching here every time. When we are asleep, when we are eating, when we are doing anything, we are preaching it. How do we manage our fertility to bring it down to the level that growth can start? I think that is the major conversation, because if you look at the 5 key steps you need to take from crisis through transition to dividend, the first one is reduction in fertility. No matter how good a planner you are, if you don't reduce your fertility rate, it will be like a man who once went out in the morning trying to feed 10 miles. When he came back in the night, he saw 15 miles on the table. He can't manage that. The second deliberate thing that we must fund increased infrastructural development in our healthcare sector. And when I mean that, it is competitive, inclusive, functional, competitive healthcare sector. The reason why I'll fly out of Nigeria to go to India for healthcare is that the healthcare system in India is better than that one in Nigeria. So we can reduce that money that is leaving the country that will aid development. So our healthcare sector must be competitive. That is the key thing. The third one, I feel, is also making sure that we have accessible, functional, appropriate, and relevant education. Not everybody would want to go to the university. Our trade schools should come back. And those are the things that we'll be able to use to make sure that the young ones that we have in so much numbers will be able to be employed and they'll be able to employ themselves. When their income per capita individually increases, their GDP increases, and then we'll take them out of trouble. Then the fourth one is ease of doing business. And I've heard other people say it in one way or the other. Government must put a functional approach to doing business, venture capital assets, reduction in multiple taxation, things that will encourage business. If you look at what happened in India, the Tata Group in 1970 set up the Indian Family Planning Foundation. In 2006, I was there to see for myself what they did. These are private sector driven, not even government, that set up the family planning services in foundation in India. And then they have made it so, and then they decided also to set up entrepreneurial schools, which train the burgeoning population of India. The last one I call the grand norm is the issue of equity, fairness, justice, civility. In Nigeria, we're not so nice to each other anymore. And it's because there are a lot of problems people grasp on a daily basis. Sibling rivalry now goes to the bone. There's an Igbo saying that says, when it comes to your brother, you can't fight to the bone. Brothers and sisters are fighting to the bone now. What is driving it? Finally, I think somebody has mentioned about the the space of climate change. Every year, the Sahara Desert is encroaching 3 to 4 meters. The Lake Chad has lost 95% of its arable land within 50 years. So those are the issues. Thank you very much.
Thank you very much, Dr. Oji. Please round of applause for him. As we round up this session, please, can you share my screen? I leave with three messages. Several panelists have also harped on that. One, we need to take a multi-sectoral approach to address the determinants of fertility. No, I'm sharing my screen. Yes, so it needs to project it. Yeah. And therein lies a conundrum for several of us in this room. Prior to now, we've had a narrow focus on supply of family planning services. This needs to change. We need to take a multi-sectoral approach. Like people said, this shouldn't be resident in the Federal Ministry of Health. It be second closing message. Rather than target our interventions on women, perhaps we should look much more critically on girls and boys and their families and community and religious leaders as agents of change. Last and big point of this session, in fact, we really need doctors or people from the health sector. We really wanted to ensure that the message around economic growth and linking this message that it's not about population growth, rather, it's about the potential dividend that the country can reap by focusing on the population age structure. And that's why, again, as agents of change in this room, we need to begin to change the way our messages are transmitted. On this note, thank you very much, and it's been a pleasure being with you.
A round of applause for these eminent personalities. Thank you so much. This conversation about us moving to demographic dividend is an ongoing one, and it's very, very important. We're moving very quickly because the minister will be here in exactly 45 minutes. It gives me pleasure to welcome to the high table the following eminent women. We just had eminent men, so it's now being balanced. You know, and we are going to talk again, how do we accelerate our demographic dividend using scorecards, you know, or how does this affect our socioeconomic aspect of our lives? And we want to hear the process and the journey so far. So very quickly, let me welcome to the high table Dr. Moji Odeku, who is the Portfolio Director, JHUCCP NORI 2 program, and also the Chairman of the National Population Commission, Honorable Nasir Issa Kwara, who is ably represented here by Dr. Adenike Ogunlewe, Director, Planning and Research, National Population Commission. Welcome to the high table, madam. Don't worry, I will. You can. So, Dr. Deku, Dr. Ogunlewe, you have the floor, please.
Thank you very much. Can you hear me? Good afternoon. It's a privilege to have this session of what we call the accountability process framework to ensure us put data to action. You recall yesterday, we were saying data should speak. Nigeria has done a lot when we are looking at the context of demographic dividend. And the monitoring framework and the process is being led by the National Population Commission. And I'm privileged to have of the chairman who had actually wanted to be here in person, but he had an emergency, just a few minutes for him driving down here. And so he's represented by Dr. Mrs. Adenike Ogunlewe. Sorry, we've given you doctor. Who is the Director of Planning and Research. I'm going to be calling the moderator of this session, who is our dearest, young, and the future of tomorrow starting now, Ms. Ade Toyeke Adedipe. Toyeke will be moderating this session with us. We have key presenters from the Bill and Melinda Gates Foundation based in Baltimore. By the way, The John Hopkins Center for Communication Program, JHUCCP, partnered with the National Population Commission to come to develop the scorecard, because scorecard, we believe, is the only way that different government, states, and national will be able to track progress. We know we've done a lot of policies, a lot of intervention, but we do need data. And I was really amazed when Professor Lanion presented some of the snapshots that we have in here. So we're going to be listening to the process of developing the scorecard for Nigeria. And this is an advocacy tool that we are privileged by Madam Koinsola Akimbo to present to NEC for Nigeria to really know where we are in the community of practice. That will be presented by Dr. Jean, who will join us virtually. And I also have other panelists who will join me here on the table. Madam Margaret Edison from National Population Commission. She didn't want to. Please join me. Dr. Kunle Omotosho from the JHUCCP Family, the Challenge Initiative. We had also wanted Joa team, maybe he's going to call in from the UNFPA to join us. So without much ado, I'm going to hand over to the anchor of this event. We are just supporting her. And when she takes us through, the National Population Commission intends to launch the scorecard here. So which tells us where we are as Nigeria, what we should be doing, in terms of data. And so we can monitor ourselves come another year through the community of practice that the National Population Commission has established. Over to the moderator.
Thank you very much, Dr. Odeku, for that wonderful introduction. Good morning once again, ladies and gentlemen, distinguished guests. So first off, we will have a presentation on the Nigeria Demographic Dividend Effort Index by Dr. Jean-Christophe Rusitira. So Dr. Jean-Christophe is the Demographic Dividend Technical Lead at the Bill and Melinda Gates Institute for Population and Reproductive Health at the Johns Hopkins Bloomberg School of Public Health. He holds a Master of Public Health from the same Johns Hopkins Bloomberg School of Public Health and a medical degree from the National University of Rwanda. He was awarded the 120 Under 40, the New Generation of Family Planning Leaders Award in 2016. He is a health advocate with a strong focus on improving quality of health through research, program efficacy, efficiency, and effective cooperation between global partners and local government. Dr. Rusatira is the founder of the Healthy People Rwanda and co-founder of the International Youth Alliance for Family Planning. Dr. Jean is joining us virtually today. Please take over, Dr. Jean. Thank you.
Thank you very much. I hope you can hear me very well. I will be presenting some of the work that we've been conducting in collaboration with the Johns Hopkins Center for Communication Programs, National Population Commission, and of course, with support of the federal government of Nigeria. Can we go next? I can also share on the screen from here if it's easier. Okay, so I will start. This is the outline of the presentation. So I'll be going through why was the DD scorecard needed, and I'll go through a little bit about the methodology that we applied in the DD framework that we have utilized, and we focus more on the DD effort index of Nigeria. And of course, we've also included some questions to look at the health and development systems resilience in face of COVID-19. Next, please. So as Dr. Olumide and Demola and every other speaker has mentioned before, we really don't have we have limited data to inform planning, and most of the time it becomes a challenge. And we have limited tools to objectively assess and evaluate progress when it comes to demographic dividend. And we have limited tools to inform prioritization of investment and resources allocation. And now with the challenge of COVID-19, we really have not previously added a component of looking at how resilient our systems as we work on developing new systems or maybe strengthening the existing systems. Please, next. So the methodology that we applied, we first conducted a systematic literature review to really come up with a framework that can help us to assess demographic dividend. And we applied this framework in 6 countries. So those are Nigeria, Ethiopia, Kenya, Rwanda, Tanzania, and Senegal, to come up with a scorecard that we hope will be useful for planning and transforming programs and services on the ground to cultivate the demographic dividend. And this scorecard has 3 main components. There's a quantitative element, and there is an effort measurement component, and there's a policy review component, because all of those 3 elements are equally valuable when it comes to planning and investing in demographic dividend. Next, please. So this is the demographic dividend framework. It really acknowledges the fact that countries are at a different stage of the demographic transition. And when you look at, for example, a country like Nigeria and a country like Rwanda, you look at the fertility trends, you can see that some countries like Rwanda has made a fast decline in fertility levels, mortality levels, and the progress has also happened in Nigeria, but it has been slower. But of course, there's an issue of size, there's an issue of, there are so many other factors, but when you look at number, there's of course that much you can tell from just the numbers. And we really wanted to go a little bit deeper and look at what are other specific sectors within different larger frameworks that countries can learn from, and what are other specific interventions that can be applied to cultivate the demographic dividend. And we grouped countries in pre-dividend and early countries based on the World Bank research. And looking at Nigeria as a pre-dividend country, in the pre-dividend country is the country where you have a fertility rate of above of 4 or more, and the working age population is projected to grow in the coming 10 years. So we try to group those countries in 2 categories, and also try to go deeper and look at within each sector what are specific interventions. And we came up with a list of interventions in each of the sector, and that's what you see in this on the left side of your screen. In these sector specific interventions that we, according to the literature, can really accelerate or can cultivate a favorable environment for the demographic dividend to happen. Next, please. So focusing on Nigeria, and I think this has already emphasized enough. You look at the population age structure, it has a broad basis, which is, of course, a characteristic of a pre-dividend country or first stage, a country in the first stage of demographic transition, which is of course characteristic of a high fertility rate, a high mortality rate, but of course it's reducing, and it's projected to reduce even further by 2030, and of course even more by 2050, as it was discussed in the previous discussion. Next, please. So this is, I just mentioned Nigeria. You can say when you look at the Journal of Demographic Dividend, you can say it's still in the pre-dividend, and this is going to become relevant as we go in the next slides. Next, please. So when we're developing the demographic dividend effort index, of course, we focused on 6 main sectors that we identified from the literature. So this is family planning, maternal and child health, education, women empowerment, governance and economic institution, and labor market. And we, of course, assessed these sectors through 5 main dimensions. We looked at policy making, we looked at services and programs, advocacy, research, and civil society organization participation, of course, at the grassroots level. Next, please. So we, of course, with this, we try to apply this work through all the standards of research. We received an IRB approval from the Johns Hopkins School of Public Health IRB committee, and we developed an online questionnaire that we tested in 6 countries. And of course, there were a questionnaire for respectively pre-dividend and early dividend countries, but they were not different, of course, within sectors. So for Nigeria specifically, we received 67 responses from experts working on the ground. And thank you very much, Charity, for facilitating this work. And of course, CCP Nigeria and the National Population Commission, because without them, we wouldn't have, of course, done this. And the idea was to really, for the country, the collaborators on the ground to identify experts on the ground who can really provide opinion on the level of effort in these respective sectors. Next, please.
Excuse me, Dr. Jean, you have 2 minutes left to the end of this. Please run through it. Thank you.
Okay, so the main results that came out of this work, we found out that the level of effort is, you can really say that it's in the moderate level, and the lowest, those that scored lowest is the labor market and women empowerment. And we use these results for the country collaborators to come up with specific policy recommendations that we hope will inform action on the ground. So next slides, I think you can go through quickly, and we share the recording for people to go through it slowly. And I've also shared a full report for people for reference if people need to. So you can also go next, please. I will spend my last minute looking at the systems resilience, which is 4 slides next to this one. Okay, so we also integrated questionnaire to look at how resilient are systems, and we looked at, of course, family planning. We looked at all of the 6 sectors, and we looked at the preparedness, absorptive capacity, recovery capacity, and adaptive capacity of these sectors. Next, please. So this is how they scored. You can go on the next slide. Yeah, you can see that in this on this slide, you can see that women empowerment and labor market scored lowest, and you can then assume or maybe say that according to the people who responded, these are sectors that people believe are not so resilient in face of COVID, and this is really a call for action for these specific sectors to be strengthened. And when you go deeper into the analysis and you can look at the report, there are specific components within different sectors that we believe will we require specific attention, especially labor market, to really make sure that the progress towards demographic dividend is maintained. I will stop from there, and I will welcome questions. And please visit the full report and explore. We've provided as much information as possible, and you are welcome to reach out if any questions. Thank you very much.
Thank you very much, Dr. Jean. Please, a round of applause for him. Thank you. So thank you very much, Dr. Jean, for that well-detailed methodology on developing of the scorecard and ensuring cross-learning. Ladies and gentlemen, please, if you have questions, please write them on the sticky notes, and questions will be taken after the panel discussion. Also, the scorecard will be launched by National Population Commission today in this session. So we are moving on to the panel discussion, and our first discussant is Dr. Olukunle Omotosho. Dr. Olukunle Omotosho is a researcher and public health specialist in health promotion, population, and reproductive health, with over 15 years of managing evidence-informed and beneficiary-led programs in the following core areas of HIV and AIDS, family planning, universal healthcare, maternal, newborn, and child health, nutrition, mental health, malaria, and gender. He has vast experience in program management and implementation of donor-funded projects. He's currently the program manager, advocacy and demand generation for the Bill and Melinda Gates Foundation funded project, the Challenge Initiative, which is implemented in Nigeria by the Johns Hopkins Center for Communication Programs. Today, Dr. Kule will be discussing with us on the process of the development of the Nigeria scorecard. Over to you, Dr. Kule.
Thank you very much, the moderator, and a good morning to our distinguished guests and participants and our spiritual leaders here. I will be talking on the process of development of the scorecard in Nigeria, and I'm happy that we have had a very solid background from the different presenters who have given perspective to issues regarding demographic dividends. While we had this challenge to look into the development of the scorecard, two major things actually are beckoned on us. The first is the issue around why do we really need this scorecard? And if you look at it critically, why Dr. Olumide was talking, it was putting us in the perspective of what will happen in 2050. And if nothing is done, the kind of disaster that might happen to our country, God forbid, hopefully we will work towards it. And we also thought about this. And if you see different partners, donors have been supporting issues around DD, but there is nothing to really track the progress, to know how far we are really moving. So that was the first thing that came to us, that we need something to track our progress, to know whether we are really moving forward, we are at a standstill, or we are retrogressing. So that was the first thing that came to us while we had this challenge to work on the development of DD scorecard. The second thing that came to us is the issue around who will lead this intervention and how do we work around it. And if you also look at the line of discussion since morning, you will see that we have been talking about the fact that this is not naturally domiciled in the Ministry of Health. It is to be domiciled where program management will really work. And we thought about it. And the first thing we did was to really work with evidence. Who has been working on this? Which ministry or agency should we domicile this? And eventually, we came to the conclusion that it should be at the program management of the National Population Commission. So when we agreed on this, we approached the National Population Commission, and we were happy to know that Mrs. Margaret has been leading issues around this particular discussion. And we also worked on the fact that we don't want a situation whereby we will limit our scope. Because if you are developing a scorecard and you don't carry as many sectors as possible along, you might not get the needed outcome. So we worked together and we formed what we call the community of practice. In the community of practice, we were able to gather a lot of partners who have been working on demographic dividends before now, and a lot who have interest from the Ministry of Women Affairs, also the agencies and the government parastatals. We also pick individuals from the youth. We also look at somebody who can speak to this from the economic planning, and we're able to form a community of practice, which was launched in February 2020. And since that time, the community of practice has been working tirelessly, reviewing the literature that GHU through BMGF sent to us to be able to see how to apply this to the context of Nigeria. Because we don't just want to have something that speaks to sub-Saharan Africa. We want something that speaks to the context of Nigeria, especially our own document that talks about harnessing DD for investing in youth in Nigeria, which was really chaired and signed by the vice president. So we worked together as a community of practice. We had several meetings virtually to discuss all this. And at the end of the day, we also worked with our Baltimore office, the BMGF Chris, to be able to get the demographic dividends effort index questionnaire, which we ran through the COP, and we had to correct it to also suit the context of Nigeria before we administer to the stakeholders. So in a nutshell, as I conclude, I want to say that we actually learned from some of the issues that have happened in the past to know that there must be a community of practice. We must properly situate these development in the right context and in the right ministry so that we can progress. And at the end of the day, we also administer the DD effort index to as many people. Some of the stakeholders who also fill the questionnaire are here seated. And what we have today is the outcome of the questionnaire you fill. And we're happy to see that this questionnaire has also gone through mock review and it has been pilot tested. Thank you very much.
Thank you very much, Dr. Kunle. Please a round of applause for him. So thank you for walking us through how the developments work to ensure that you harnessed success through institutional capacity and working with members of the community of practice. Once again, if you have questions, please write them on the sticky note and it will be discussed after the panel. For our next panelist, I have with me Ms. Margaret Edison, who is the Deputy Director Planning, Population and Development at the National Population Commission in Nigeria. She is a demographer with vast experience and expertise in population and development, including demographic dividend. Through her work, she has addressed issues of reproductive health, family planning, maternal, newborn, child and adolescent health, aging, and many other aspects of population and development. Today, Ms. Margaret will be talking us through the future, mechanisms for effective coordination, monitoring of the Nigeria demographic dividend progress. Thank you very much, Ms. Margaret. You're welcome.
Thank you very much. I request to stand by the existing protocol. And I want to thank our colleague from Johns Hopkins who gave an overview on how the process that took us to where we are today. And I also want to thank my colleague, Omotosho, all the Nuri who have transited to Johns Hopkins Communication Center program have been a great source of encouragement to the National Population Commission. I don't want to go through the process that brought us to working together, but I just want to say that from the reports that have come out of the DDEI, it has showed that Nigeria is in a moderate level of efforts. For us to meet the targets we've set for ourselves within the roadmap for the demographic dividends, investing in youth, as well as the revised national policy on population for sustainable development. I think they are both tied together because the thrust of that policy is to achieve sustainable development derived from achieving demographic dividends. So going forward, the first thing, the issue of family planning has been emphasized many times over here today from the Minister of State and every other person that have made presentation here today. We need to strengthen programming on family planning. That is the first step that can lead us to bringing down our fertility without getting more acceptors of the modern family planning practices in Nigeria. There is no how we can bring down our fertility. And without bringing down fertility, we won't be able to tamper with our age structure. It will still remain very large at the base. If we saw the pyramid that was showed by our presenter from Johns Hopkins, so we need family planning. We also need to have a zero tolerance for maternal death, newborn and the under 5. And I know that Nigeria committed at Nairobi last year to achieve zero maternal death. And we stand on that when we celebrated the first anniversary.
Ladies and gentlemen of the hotel, F&B, please can you stop moving around? You're causing a ruckus. Gentlemen, I see you in the suit. Please stop moving the chairs. You're making noise. Thank you. Over to you.
Thank you very much. So we've made that commitment. And when we celebrated the first anniversary in Nigeria on the 12th of November, we reiterated our commitment to ensure zero maternal death. And by that, we also commit in country to having 0 newborn death and 0 under 5 death. So those are some of the things we have to do in going forward. Then the next thing we have to do, we have to look at education from the basic. At least every Nigerian child, at the minimum, should complete secondary school level. Education, if you look at the DHS data and every other data, you see that the relationship between education and the outcomes in the different issues that are mentioned in terms of family planning, education, the girl child, and men, education has a very positive impact in making us achieve the demographic dividend. So the government have to review and make sure we increase investment in education going forward. We also need to look at what are the institutions that can drive efforts, that can make us to accelerate our efforts, is good governance, accountability, transparency, and the rule of law. Then the women, if you look at the index, the women outcome was one of the lowest. So we need to invest in gender parity, making sure that we have a lot of women engaged in labor market, engaged in decision making, both at the household level and at the country level. Then the next thing we need to look at going forward, you know, we have a very large youth population. We need to invest in their education. We need to invest in job creation. Those creating jobs for them is one of the things that can accelerate economic growth. So we need to do that. Then the next step we need to do, launching the DDEI today is just the first step. We need to use the information. We need to construct new ones to give us information to assess, to monitor progress, to bridge gaps, and know what to do, not only at the national level, but also at the subnational level to the community level. We know we are emphasizing the primary health care, community intervention, religious and traditional involvement, and most of these are found at the community level. Those are the things we need to put together. We need to promote partnership and collaboration with the civil society and all other stakeholders that are members of the community of practice to be able to accelerate our effort towards achieving the demographic dividends. Thank you.
Thank you very much, Ms. Edison, for that, informing us of the various investments we need to make to ensure demographic dividend. Ladies and gentlemen, distinguished guests, please, do we have any questions from the floor here? Do we have any questions from the chat room online? Okay, so while we wait on feedback for that, we have a few questions here. So Dr. Jean, now that we've noted Nigeria's level of progress as a pre-dividend country, what are the next steps to ensure that Nigeria sustains the policy pathway and commitments to achieve a plausible goal?
Thank you very much. Thank you very much. I think when you look at the where Nigeria stands, you definitely think of how can we establish a favorable environment for demographic dividend to happen. So that involves fertility reduction, as Demola has mentioned. I think Olumide also mentioned it, and also really developing the human capital, which also has been highlighted very much enough. And I'm now adding a third element, really ensuring resilience, because with the climate change, with all of the crises happening, it's likely that probably even more crises may happen. So we better get ready for that as we think of systems. So that's what I can imagine. And more importantly, the women empowerment issue has really, across all the sectors, you can see that it requires special attention.
Thank you very much, Dr. Jean, for that detailed response. So over to you, Dr. Kunle. Were there bottlenecks in the course of the development of the scorecard? And if there were, how were they resolved?
Thank you very much for the question. Yes, we had some bottlenecks while we were developing the scorecards We started off from the office of the Vice President of Nigeria, because that was where the issues relating to demographic dividends was initially situated. So we had actually gone far, having discussions with the committee and the members in charge of DD efforts in the office of the Vice President. Unfortunately, and because of political restructuring, the committee and the development was actually moved away from the office of the Vice President. So that particular effort, in a way, was taken from that office. And because of that, we had to re-strategize. And it was after then we had several meetings again to be able to discuss on where again can we situate these efforts. And we finalized with the National Population Commission. So that, in a way, set us back for some weeks, but we were able to overcome the challenge. Another major bottleneck was the inability of the COP members to meet physically. You will all agree with me that COVID-19 caused a lot of destruction to issues regarding meetings, and a lot of people were not used to virtual meetings. So at the beginning, we found it difficult, really, to meet, to agree on documents, to review documents, and do a lot of this. But thanks to the resilience of all the members of the COP, we were able to overcome this. And I stand to really tell you here that all the meetings we had since the beginning of COVID were virtual meetings, and still we were able to come up with this document, which is going to be launched today. So these are just two of the bottlenecks that we had in the course of the development. Thank you.
Thank you very much, Dr. Kule. So if permit me to say, if this is correct, that the bottleneck of political restructuring created the avenue for institutional engagement of working with the National Population Commission.
Exactly.
Wonderful. So sometimes bottlenecks are good in the work that we do. So Ms. Edison, so please, can you discuss with us how the scorecard will be used and disseminated?
Thank you very much. I want to add here that while we were developing the scorecard, we were able to also develop a policy brief that will ask government on a lot of things relating to those 6 sectors and the pillars, the thematic pillars in the roadmap. So one of the ways we want to use it is to assess ourselves. How much progress have we made? What are the gaps? What do we need to do? I've enumerated a lot of things that we need to do. So the scorecard will help us to situate the right action that we need to take. In terms of dissemination, we need to engage from the highest to the lowest level, from the National Assembly, and we need to work very closely with the Nigerian Governors Forum, because they are the ones that are interacting with the people. We also need to engage our traditional and our religious leaders. We need to disseminate it down to the community level. We need to disseminate it with all the sectors that are involved in constructing the card, the women, the market women, the National Council of Women Society. As many as we can reach out, we will disseminate this DDEI to everyone in Nigeria. And we will combine that with when we will be disseminating our national policy as well, and any other document that we intend to do. We are going to combine everything we do from the national to the state to the community level. So we will not have any copy left in our office. We will disseminate every copy and we'll ask you to print more for us. And I want to mention here that while we were vetting this document, I took it to our executive chairman, Honorable Nasser Issa Kwara. He was very excited. He really wanted to be here. So he vetted the document by himself. He said, oh, that he even prefers to work in population and development, give more attention to it, because he has seen that it's relating to the life of the people. So he would have been here today. So it's something that he has passion about. And I think that will give us a plus in carrying out the dissemination. Thank you.
Okay, thank you very much, Ms. Margaret, for that response. I'll hand over to the chairman of the session. Thank you, ma'am.
Thank you very much, Adetoyeke and the panelists. And I must also acknowledge comments that have come from the virtual platform. Dr. Tunde Shegun had given me, we don't have the privilege of streaming them here, but they are there and it's commendable. They're quite excited that we do have a scorecard tool that we can now use to track our progress. We know we're progressing, but it would also enhance, stimulate, and motivate us to do much more. Now, to set the tone for the launching of the DD scorecard today, I'm going to hand over to the Honorable Chair of National Population Commission, Honorable Nasar Issa Kwara, ably represented here by Mrs. Adenike Ogunlewe. Over to you, ma'am.
Thank you very much. Distinguished ladies and gentlemen, please permit me to adopt the already established protocol this morning. I'm here to represent the chairman of the National Population Commission, Honorable Nasir Issa Kwara, who planned to be here this morning but could not make it. In fact, it was, as explained earlier, he was already on his way when he was informed that one of the members of the commission died earlier on today, and he was a Muslim, and we know as the Islamic culture, he has to be buried today. So the chairman has led a delegate to the burial place in Niger State. I therefore here present his brief remarks on accelerating Nigeria demographic dividend scorecards for effective policy and socio-economic impact assessment, the progress and process so far. I'm very delighted and honored to be a part of this important event, focused on issues that I'm passionate about, as indicated by the theme of the session. May I take this opportunity to acknowledge the effective partnership, collaboration, and support from Johns Hopkins University Center for Communication program that has enabled milestones of achievement in developing the demographic dividend scorecard for Nigeria and the policy brief. Thank you for supporting Nigeria to establish a country-level community of DD practice, whose commitment contributed immensely to producing these important documents. 1, Demographic Dividend Effort Index Report, and 2, the Nigeria Demographic Dividend Policy Brief. The existence of the scorecard, which is a veritable tool for tracking our national progress at harnessing demographic dividend, will permit periodic assessments of our performances at different levels and sectors, guided by the roadmap launched in 2017. The policy brief, as well as the recommendations in the report, will arouse the consciousness of policy and decision makers to sustain commitments and take responsibility to address issues highlighted for attention in the brief. The scorecard will facilitate effective implementation of relevant policies targeted at improving the standards of living and quality of life of all the people of Nigeria, which will eventually create opportunities for accelerated economic growth. This is particularly critical to effective implementation of the revised national policy on population for sustainable development, about to be considered and approved by the Federal Executive Council. Thank you for listening. Okay. once again, on behalf of the Chairman, National Population Commission, Alhaji Issa Kwara, with these few remarks earlier made, and on behalf of the federal government of Nigeria, the DD community practice, and the people of Nigeria, I hereby launch these two important products. As we commence the decades of action and outcomes, I request for elaborate dissemination and use of the information in these two documents to guide policy decisions and actions in Nigeria. Thank you.
So thank you very much. On this note, we are wrapping up this session. We want to also encourage us. This document is rich and it's summary for all programmers policy level. We also have the commitment of the special assistant to the president to make this available at the next meeting in January as part of the holistic report of this conference. I must say I'm really excited that we do really have trackers now to, as NPOPC will be using this document yearly to look at progress, and we can speak to all the efforts, and it will encourage us that we are moving and we have data to track that movement. Thank you for your attention. Thank you as we await the next session.
A round of applause for this wonderful session. Moving demographic dividend forward using accountability mechanisms, scorecards, is something that will help us. So we have, you know, for those who are Christians, there's someone who was called John the Baptist. He was a forerunner. So we have the director, family health department here, who is the forerunner of the Honorable Minister of Health, who is currently on his way. But let me crave the indulgence of the House to give Professor Ladipo just 2 minutes. I hear Professor Ladipo has some vital comments he wants to pass on this issue of scorecards. Professor Ladipo, sir, 2 minutes, sir.
Thank you very much indeed. Let me commend the efforts of Bill and Melinda Gates Foundation for moving forward this agenda of scorecard. As all the speakers spoke, I was very excited at the achievements. I considered the investment to get this scorecard, and I also evaluated the potential impact of the scorecard vis-a-vis our track record. Everyone here present knows about demographic dividends and the reason for advocating for us to achieve demographic dividend. One of the presenters said by 2050, we should have a total fertility of 3.7. And at 2030, it should be like, I think, 4 point something. Ladies and gentlemen, that will not help. There's already a huge youthful population that will reproduce, that are expected to reproduce. And that is what we refer to as built-in momentum. What is important for this government to come out clearly for is to say, ladies and gentlemen, men should not have more than 3 children. Men should be encouraged to have only 3 children. Nothing to do with women. Now, ladies and gentlemen, let us be guided by the ICPD plus 25 consensus statement. It says 0 unmet need, 0 tolerance to unmet need for contraception, and 0 unmet need for preventable maternal death, and then 0 tolerance for gender-based violence, etc., etc. We've touched on this. I think, ladies and gentlemen, we need to move the agenda forward, and I want to appeal to Bill Gates Foundation again. If your effort is to have positive impact, you need to take this document to another level. I want to see publication, front page of every newspaper, prime time, radio and television, information on this scorecard and the rationale for it and the implication of not following it through. You see, we are speaking to ourselves all the time. That is why our progress has been slow. We need to translate this document so that the young children in secondary school will understand. People in the university will understand. That is the only way there will be community support for this change that we're advocating. If we don't translate it, like I was telling somebody sitting by me, if I call somebody, one of the kitchen staff here, have you ever heard of demographic dividend? They say no. Have you ever heard of family planning as a priority for economic growth and improvement in quality of life? He or she will say no. So let us stop talking to ourselves. Let's move to the next level. The next level, translate it in a way that the ordinary man on the street will understand. Children in the school will understand. That is when we'll begin to have commitment at the highest level, commitment at the community level. And then, of course, we need to engage the Governors Forum. Thank you.
A round of applause for Professor Ladipo. You know, one of the distinguishing marks of a professor is that they are so learned that they just break everything down for you in simple doses. Almost like, you know, thank you so much for those comments. The good thing about technology is that what you have said is recorded and it can be played until it gets to those who need to hear it.